Hello and welcome to the Answers for Cancers podcast. So today we're going to speak about the pre-treatment tests required before you start ACT chemotherapy. So before you start ACT chemotherapy, you will have some pre-treatment tests, also known as baseline tests. So these tests do vary depending on the type of chemotherapy you're having. So the following one spoke about in this particular podcast is just what's required before starting ACT chemotherapy. So the first one is different types of blood tests, including full blood count, liver profile, and renal profile. So a full blood count is a blood test that measures different components of the blood, including red blood cells, white blood cells, neutrophils, and platelets. And this test can provide important information about a person's overall health and can help identify conditions such as anemia, infections, and blood disorders. A liver profile, also known as a liver function test, and a renal profile, also known as a renal function test, measures different enzymes and proteins produced by the liver and the kidneys, and these tests can help assess the health and the function of both the liver and the kidneys. And if you want to know more information on the different enzymes and proteins that are measured, you can find that information within the written information provided within this app. So moving on from there, the next type of test you will have is heart functioning tests. So AC can have effects on the function of your heart. Therefore, it's very important to have baseline tests of your heart function before you start to make sure there are no abnormalities. So these tests include an ECG and an echo. Both of these tests will be organised by your treating team, and you should receive an appointment to have these done before your first treatment. So an ECG stands for an electrocardiogram, and it's a test that measures the electrical activity of your heart. This test is done by placing electrodes on the skin of your chest, arms and legs, which detect and record the electrical signals produced by the heart as it beats. So it's used to diagnose various heart conditions, including arrhythmias, heart attacks, and heart disease. And it can also be used to monitor the effectiveness of medications and treatments for these types of conditions. So AC can have effects on the function of the heart. So it's very important before starting AC to get a baseline ECG of the heart. So during an ECG test, the patient will lie down while the electrodes are placed on their skin. So usually there's stickers first, and then they connect the electrodes to the stickers. And the test is completely painless. It usually only takes a couple of minutes to complete, and the results are recorded on a graph called an electrocardiogram, which is then interpreted by a doctor or other healthcare professionals. The second test that monitors the function of the heart is something that's called an echo or an echocardiogram, and it's a test that uses ultrasound technology to create images of the heart. So this is also a non-invasive and painless procedure, and it can provide valuable information about the structure and function of the heart. So during an echo, a small device called a transducer is placed on the chest or abdomen and emits high-frequency sound waves. So these sound waves bounce off the structures of the heart and are then picked up by the transducer and translated into images on a screen. So echocardiograms can be used to diagnose a variety of heart conditions, including heart valve disease, heart failure, congenital heart defects, and pericardial disease. They can also be used to monitor the effectiveness of treatments for these types of conditions. So an echo will measure the left ventricular ejection fraction, and this measurement is a measurement of the percentage of the blood that is pumped out of the left ventricle of the heart with each contraction. So it's an important indicator of the heart function and is often used to diagnose and monitor heart failure. In order for you to receive AC chemotherapy, the left ventricular ejection fraction must be above 50% to receive AC chemotherapy. So moving on from that, they're the pre-treatment tests, and then we'll move on to some regular tests. So while you're on chemotherapy, you will have regular blood monitoring. So you'll have repeat full blood count, liver profile, renal profile, and bone profile as part of your monitoring throughout your chemotherapy. And these will be done before every cycle, and depending on the hospital you're in, you may have the blood test done the day before or the day of treatment. And then disease monitoring, so this should be in line with your treatment plan. And it usually involves a CT scan before you start your treatment and also after you finish your chemotherapy. And another way of disease monitoring is a blood test known as CA153 that can be used as an indicator of how effective your disease is responding to the treatment. And finally, heart function tests. So these are only required as a baseline test, but they can be repeated if clinically indicated. So if there's any changes or signs or symptoms that there's been a change to the heart function, your clinician may require to have repeats of ECG or an echo. And all of these recommendations are based on the National Cancer Control Programme guidelines, and you can find more information on these guidelines within the app in the written information section.